Hello, my name is Dr. Jane Taylor, and you are very welcome to Male Secret 60 Plus, the channel where we talk openly about men's health after 60. No taboos, just science. Today, we're going to tackle a topic that affects millions of Brazilian men and that many are still ashamed to discuss: the relationship between type 2 diabetes and loss of sexual function. The numbers are alarming. Studies show that approximately 75% of men with diabetes will experience some degree of erectile dysfunction during their lifetime. But before you think this is a life sentence, I want you to know that there is a lot you can do to prevent, treat, and even reverse this situation. So stay with me until the end of this video, because I'm going to share information that can literally transform your life. Before we dive in, a special request. If you're watching this video and you're not yet subscribed to the channel, hit that subscribe button right now and turn on the notification bell. Our commitment here is to deliver high-quality, science-based information so you can make the best decisions for your health. And if this content is helpful to you, please share it with your friends, your partner, because sexual health is integral health. And the more people who have access to this information, the better. Now let's get to the point. When we talk about type 2 diabetes, most people immediately think of blood sugar, diet control, insulin, or metformin. Very few people connect diabetes with sexual life. But the truth is that these two things are deeply linked. To understand this connection, we first need to understand what really happens in the body of a man with type 2 diabetes and how it specifically affects the ability to get and maintain an erection. Type 2 diabetes is a metabolic condition characterized by insulin resistance and chronically elevated blood glucose levels. When you eat, your body turns carbohydrates into glucose, the main energy source for your cells. Insulin, produced by the pancreas, is the hormone that allows this glucose to enter the cells. In type 2 diabetes, the cells don't respond properly to insulin, so the pancreas has to produce more and more of it to compensate. Over time, the pancreas can't keep up, and blood glucose stays high. This excess sugar circulating in the body is not harmless. It causes progressive damage to many systems. And that's exactly where sexual function comes into play. For a man to achieve an erection, a series of perfectly coordinated physiological events must occur. It all starts with sexual stimulation, visual, mental, or physical. This triggers a nervous system response that releases chemical substances in the penile tissue. These substances cause the blood vessels leading to the penis to dilate dramatically, allowing a massive increase in blood flow. At the same time, the spongy tissues of the penis, the corpora cavernosa, fill with blood and expand, while special valves prevent the blood from leaving quickly. It's this buildup of blood under pressure that creates and maintains the rigidity needed for penetration. It sounds simple when explained like this, but it's actually an extremely complex process that depends on healthy blood vessels, perfectly functioning nerves, proper hormone levels, and precise chemical balance. Now imagine what happens when you have high blood glucose levels for months or years. First, excess sugar damages the inner lining of blood vessels, a process called endothelial dysfunction. The endothelium is the layer of cells lining all your blood vessels and plays a crucial role in regulating blood flow. When damaged by excess glucose, these cells lose the ability to produce enough nitric oxide. Nitric oxide is absolutely essential for erection because it signals the smooth muscles in blood vessels to relax and allow increased blood flow. Without enough nitric oxide, adequate erection simply doesn't happen, no matter how mentally aroused you are. Second, diabetes causes advanced glycation, where sugar molecules permanently bind to body proteins, including those in blood vessel walls. This makes vessels stiffer, less elastic, and less able to dilate when needed. Think of blood vessels as flexible hoses that need to expand to allow more flow. Diabetes essentially hardens those hoses. In the tiny blood vessels of the penis, which need to dilate several times their normal size during erection, this effect is devastating. But the damage doesn't stop there. Diabetes also causes diabetic neuropathy, progressive nerve damage from chronic high glucose exposure. Nerves are like electrical wires carrying signals throughout the body. When those wires are damaged, signals don't reach their destination properly. For sexual function, this means that even when the brain sends the time for an erection signal, it may not reach the penile tissues correctly. It's like trying to turn on a device with damaged wiring. Neuropathy can also reduce penile sensitivity, making sex less pleasurable even when erection is possible. Another critical factor is the impact on hormones, especially testosterone. Studies show that men with type 2 diabetes have significantly lower testosterone levels than men of the same age without diabetes. Testosterone isn't just important for libido. It directly affects penile tissue health and erectile capacity. Low testosterone leads to reduced sex drive, fewer spontaneous nighttime morning erections, which are important for tissue oxygenation, and poorer erection quality. It's a vicious cycle because obesity, very common in type 2 diabetes, also lowers testosterone by converting it into estrogen in fat tissue. Chronic inflammation is another key player. Type 2 diabetes is essentially a chronic inflammatory condition. High glucose causes oxidative stress and inflammatory molecules that damage blood vessels further, interfere with hormonal signaling, and worsen endothelial dysfunction. The penis, with its dense network of tiny blood vessels, is often one of the first places symptoms appear. In fact, many experts consider erectile dysfunction an early warning sign of broader cardiovascular disease. Now you might be wondering, why the 75% statistic? It comes from decades of studies consistently showing that 3 out of 4 men with diabetes will experience some degree of ED. The risk increases with duration and poor control of diabetes, reaching 85 to 90% in long-term poorly controlled cases. And here's something important. ED in diabetic men tends to appear 10 to 15 years earlier than in non-diabetic men. But before you get completely discouraged, here's the crucial message. None of this is inevitable. The key is in 3 words: prevention, control, and treatment. Let's start with prevention. And even if you already have diabetes, preventing progression and complications is absolutely possible. The single most important strategy is strict blood glucose control. Studies clearly show that men who keep their HbA1c, the 3-month average blood sugar test, below 7% have significantly lower rates of erectile dysfunction. Every percentage point improvement in HbA1c means less damage to blood vessels and nerves. This requires regular monitoring, medication adherence, and, most importantly, sustainable lifestyle changes. Diet is fundamental. I'm not talking about extreme or impossible diets. I'm talking about conscious, sustainable choices. Plenty of vegetables, low glycemic fruits, whole grains, lean proteins, and healthy fats. Drastically reduce refined carbs, added sugars, sugary drinks, and ultra-processed foods. Focus on foods that improve insulin sensitivity. High-fiber vegetables, berries, nuts, seeds, quality proteins, especially omega-3 rich fatty fish, and healthy fats like extra virgin olive oil and avocado. Exercise is non-negotiable. And here's something that might surprise you. Regular physical activity is as effective as many medications for controlling type 2 diabetes. Exercise improves insulin sensitivity for days after each session, helps lose dangerous visceral fat, boosts testosterone, reduces inflammation, improves cardiovascular health, and directly enhances blood flow to the penis. The ideal combination? At least 150 minutes per week of moderate aerobic exercise, brisk walking, cycling, swimming. Strength training 2 to 3 times per week. Building muscle dramatically improves glucose control and testosterone levels. Weight control deserves special mention. Losing just 5 to 10% of body weight can dramatically improve both diabetes control and erectile function. Sleep, stress management, quitting smoking, and moderate alcohol consumption are also critical pieces of the puzzle. Now let's talk about treatment. Because even if you're already experiencing diabetes-related ED, there are many effective options. First-line treatment: PDE5 inhibitors, sildenafil, Viagra, tadalafil, Cialis, etc. They work by enhancing nitric oxide effects and are effective in 60 to 70% of diabetic men, sometimes requiring higher doses. If oral medications don't work or aren't suitable, penile injections, alprostadil, highly effective, 85%. Vacuum erection devices, penile implants, for severe cases. Satisfaction rates, 90%. Optimizing diabetes treatment itself is essential. Newer medications, GLP-1 agonists, SGLT2 inhibitors, often improve both glucose control and sexual function. Testosterone replacement may help men with confirmed low levels under medical supervision. Psychological support and couples therapy can break the vicious cycle of performance anxiety. Communication with your partner is crucial. Hiding the problem only increases stress. And remember, sexuality after 60 is different, but it can be deeply satisfying. Intimacy, pleasure, and connection matter more than perfect mechanics. Pelvic floor, Kegel, exercises, regular sexual activity to oxygenate tissues, and avoiding supplements without medical guidance are also important strategies. Finally, you are not alone, and this is not hopeless. Millions of men face the same challenges, and many have found solutions that work for them. The first step is acknowledging the problem. The second is educating yourself, which you're doing right now. The third is taking action. Talk to your doctor, make lifestyle changes, seek treatment. Sexual health is not a luxury. It's a fundamental part of overall health and quality of life. You deserve it at any age. If you made it to the end of this video, thank you for investing in your health. If this content helped you, please give it a like, share it with other men who need this information, and subscribe to Male Secret 60 Plus for more no-taboo men's health content. In the comments, I'd love to hear your experiences, questions, or success stories. Sharing helps others feel less alone. I'm Dr. Jane Taylor, and I'll see you in the next video. Take care, control your diabetes, stay active, and don't hesitate to seek the help you deserve. Your sexual health matters, and you have the power to do something about it. See you soon.